I would like to introduce you to my teacher, Sri Srinathan sir.
Thank you.
He was my high school teacher. He taught us mathematics and physics. And I happened to treat his shoulder also. Not as a student, as a doctor. And he has chosen his student to be a doctor for his shoulder. Sir, which shoulder we operated, sir? Right shoulder, Allah?
Right shoulder.
Okay. Sir, when did we operate?
I think April, May.
May. It was May.
May.
May 2022. My teacher approached me with a shoulder pain and inability to raise the arm above. So we did a scan and found out he had a massive rotator cuff tear. I did an arthroscopic rotator cuff repair. ಈ ಆರ್ಥೋಸ್ಕೋಪಿಕ್ rotator cuff repair ಏನಂದ್ರೆ ಈ ಮಸಲ್ ಕಟ್ ಆಗಿ ಹಿಂದಕ್ಕೆ ಹೋಗಿರೋದನ್ನ ಮತ್ತೆ ಪೊಸಿಷನ್ ಕೂರಿಸಿ ಫಿಕ್ಸ್ ಮಾಡುವಂಥದ್ದು. ಈಗ ಆಲ್ಮೋಸ್ಟ್ 8 months ಆಗಿದೆ. 8 months ಆಗಿದೆ ಸರ್, 8-9 months ಆಗಿದೆ. ಚೆನ್ನಾಗಿದ್ದಾರೆ ಸರ್, ಚೆನ್ನಾಗಿದ್ದಾರೆ. ಇವಾಗ ಬೇಸಿಕ್ಲಿ ಏನಕ್ಕೆ ಸರ್ ಇವತ್ತು ನಮ್ಮೊಂದಿಗೆ ಇದ್ದಾರೆ ಅಂದ್ರೆ ನಮ್ಮ ಪ್ರಿಯಾ ಅವರು ಇವಾಗ ನಮ್ಮ ಟೀಚರ್ಗೆ ಹೇಗೆ ಸರ್ಜರಿ ಮಾಡಿದ್ರಿ ನೀವು ಯೂಶಲಿ ಪೇರೆಂಟ್ಸ್ಗಾಗಲಿ ಟೀಚರ್ಸ್ಗಾಗಲಿ ನಿಯರ್ ಅಂಡ್ ಡಿಯರ್ ಒನ್ಸ್ಗಾಗಲಿ ಯೂಶಲಿ ಸರ್ಜರಿ ಮಾಡಕ್ ಹೋಗಲ್ವಲ್ಲ, ಬೇರೆಯವ್ರ ಮಟ್ಟಕ್ಕೆ ಹೋಗಲ್ವಲ್ಲ. ನಿಮ್ಮ ಕೈ ನೈಫ್ ಹಿಡಿಬೇಕಾದ್ರೆ ಏನು ಶೇಕ್ ಆಗಿಲ್ವಾ? ಈ ಮುನ್ನಬ MBBS ಅಲ್ಲಿ ನೋಡಿದಂಗೆ ಅಥವಾ ಇವರು ನಮ್ಮ ಪ್ರಿಯಾದವರು ಕ್ವೆಶನ್ ಕೇಳಿದ್ರು. ಆ ಕ್ವೆಶನ್ಸ್ಗೋಸ್ಕರ ಪ್ರಿಯಾ ಅವರ ಇದಕ್ಕೋಸ್ಕರ ನಾವು ಇದನ್ನ ಮಾತುಕತೆ ಮಾಡ್ತಿದ್ವಿ ಈಗ.
Maybe teacher is teacher, but he is a doctor. As a doctor, I respect him. ನಾನು ಸಿಂಗುಲರ್ ಮಾತಾಡಲ್ಲ. As a doctor, I used to respect him. As a teacher, he respects me. That is mutual respect.
Exactly.
ಆಮೇಲೆ ಹೇಳಿದ ತಕ್ಷಣ ನನಗೆ ಅಷ್ಟೇನಾ ಅಂತ ಹೇಳಿದೆ. ಅಷ್ಟೇನಾ? ಸೊ ಐ ಥಾಟ್ ಬೋನ್ ಏನಾಗಿಲ್ಲ. ಆಮೇಲೆ ಏನಾಯ್ತು, ಇಲ್ಲ ಸರ್, ಸೊ ಅದ್ರ ಪ್ರಾಬ್ಲಮ್ ಇಟ್ ಈಸ್ ಎ ಗ್ರೇಟರ್ ಪ್ರಾಬ್ಲಮ್ ದ್ಯಾನ್ ದಿ ಬೋನ್ ಪ್ರಾಬ್ಲಮ್. ಹೌದಾ ಅಂದ್ರೆ ದೆನ್ immediately he told. Immediately said there is a tear. So then he sent me to the MRI. He only referred to some person. I went over there. After 2 days I came with the report, and report says clearly that
Massive rotator cuff tear.
Okay.
Muscle which is responsible to raise the arm. Complete 4 muscle ಇರ್ತದೆ, 3 muscle tear.
ಸರ್, ಇದು ಬಿಕಾಸ್ ಆಫ್ ದ ಏಜ್ ಆರ್ ಏನ್?
ಚಿಕ್ಕ ವಯಸ್ಸಿನಲ್ಲಿ ಯೂಶುವಲಿ ಇಂಜುರೀಸ್ ಎಲ್ಲ ಆದಾಗ ಆಗುತ್ತೆ. ಏಜ್ ಆದಾಗ ಏನಾಗುತ್ತೆ, ಮಸಲ್ ಅಲ್ಲಿ ಬ್ಲಡ್ ಸರ್ಕ್ಯುಲೇಷನ್ ಕಡಿಮೆ ಆಗಿ ಸ್ಪಾಂಟೇನಿಯಸ್ ಆಗಿ ರಪ್ಚರ್ ಆಗುತ್ತೆ.
ಓಕೆ.
ವೆನ್ ಇಟ್ ಹ್ಯಾಪನ್ಸ್ ಲಾ, ಇಟ್ಸ್ ಎ ಪೇನ್ಫುಲ್ ಥಿಂಗ್. ಪೇನ್ಫುಲ್ ಒಂದು. ಎರಡನೇದು ಬಂದ್ಬಿಟ್ಟು ಕೈ ಮೇಲೆತ್ತಕ್ಕಾಗಲ್ಲ, ನಾವೇನು ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಂಡಿಲ್ಲ ಅಂದ್ರೆ ಏನಾಗುತ್ತೆ, ಶೋಲ್ಡರ್ ಜಾಯಿಂಟ್ ಡೈನಾಮಿಕ್ಸ್ ಚೇಂಜ್ ಆಗೋದ್ರಿಂದ ಶೋಲ್ಡರ್ ಜಾಯಿಂಟ್ ಸವಿಯಕ್ಕೆ ಶುರು ಆಗುತ್ತೆ. ಸವಿಯಕ್ಕೆ ಶುರು ಆದ್ರೆ ಜಾಯಿಂಟ್ ಬದಲಾಯಿಸಬೇಕು. ಈಗ ನಾವೇನಾದ್ರು ಮಾಡಿದ್ರೆ ಮ್ಯಾಸಿವ್ ಟೇರ್ಸ್ಗೆ ಇಟ್ಸ್ ಎ ಕೀ ಹೋಲ್ ಸರ್ಜರಿ. ನೆಕ್ಸ್ಟ್ ಜಾಯಿಂಟೇ ಬದಲಾಯಿಸಬೇಕು. ಇವಾಗ ನಾವು ಮಾಡಿದ್ರೆ ನ್ಯಾಚುರಲ್ಸ್ ರಿಸ್ಟೋರ್ ಮಾಡಿದಾಗೆ, ಮುಂದಕ್ಕೆ ಆರ್ಟಿಫಿಷಿಯಲ್. ಸೊ ಹಾಗಾಗಿ ಐ ಎಕ್ಸ್ಪ್ಲೈನ್ ಮೈ ಸರ್ ಇದು ಮಾಡೋಣ, ಪ್ರಾಬ್ಲಮ್ ಇದೆ, ಇದಕ್ಕೆ ಸರ್ಜರಿ ಬೇಕು ಅಂತ. ಬಟ್ ನಮ್ಮ ಸರ್ಗೆ ಸ್ವಲ್ಪ ಚಾಲೆಂಜಸ್ ಇತ್ತು. ಚಾಲೆಂಜಸ್ ಏನಂದ್ರೆ ಅವ್ರ ಹೆಲ್ತ್ ಇಶ್ಯೂಸ್ ಅಲ್ಲಿ ಅವ್ರಿಗೆ ಲಂಗ್ ಅಲ್ಲಿ ಒಂದು ಪ್ರಾಬ್ಲಮ್ ಇತ್ತು. ಸೊ ಹಾಗಾಗಿ ನಾವು ಅನಸ್ತೇಷಿಯಾ ಕೊಡೋದಕ್ಕೆ ಹೆದರ್ಕೋತಾ ಇದ್ವಿ. ಹೇಗಪ್ಪ ನಮ್ಮ ಸರ್ಗೆ ಒಂದೆಲ್ಲಾಗಿದೆ, ಅನಸ್ತೇಷಿಯಾ ಹೇಗೆ ಕೊಡೋದು ಅಂತ. ಸರೇ ನಮ್ಗೆ ಧೈರ್ಯ ಕೊಟ್ಟರು, ಮಾಡಿ ಏನಾಗೋದಿಲ್ಲ ಅಂತ.
Sir, I want to know, usually we have all that in our mindset. Doctors usually generally don't operate their own relatives, family members, or near and dear ones. So here you have operated your own teacher, a high school teacher whom you know from a very long time. So what was your experience? How was your feeling when he approached you? What did you think of?
See, actually that's an emotional moment for everyone. One thing what I felt was, see, we have learned many things from them. Today what we are, it is because of their hard work. And when I have got the result, because of my expertise, if my teacher can get better, what else you want? Correct.
Right.
And then I felt this is a God's given opportunity to use my expertise to help my teacher to get back to normalcy. That's how I felt. That because my sense of responsibility. When your sense of responsibility is more, emotion will not affect you much. So that is what I would tell.
So I have a bit to add here. So when it is your own close ones whom you actually know, and teachers are somebody, we treat them like a god. So here when such people come to approach you, do you give some additional or special care and attention to them, or you just treat normally like how you treat other patients?
To be honest, I treat everyone the same. You cannot be partial to someone. You should treat everyone as the same. Okay? Even forget about let's forget about that. Srinathan sir is not my teacher. Okay, and he is a 70-plus-year-old gentleman. 77 also sir, 78.
78.
78. When a 78-year-old person comes to you, obviously you are going to. He is very much elder to you. You are treating him with respect.
Right.
Whether it's teacher or any other profession or neither profession, it doesn't matter. It becomes your duty to be humble and then treat them with a lot of respect.
Right. But here, say for example, when it is some other patient, or maybe your sir, they will be little scared. Some patients are scared when they are going under surgery and all. So that time they will trust you because they know you. So that time, say during the surgery, would you actually explain all the reality, what they are going through, what kind of surgery to be done?
First and foremost thing, as a doctor, what I feel is, I will treat every patient as the same. Number one, I will explain everything A to Z about the procedure, about the diagnosis, about the outcome, and sometimes if there is any complication, I will explain them and also tell them how I can bail them out of the complication if something happens. So then that gives the confidence to the patient to trust the doctor and to trust the treatment as well.
Right.
So
actually, he explained me everything. So I thought it may be open and then he will make the stitch and all that. Then he said, no, it is not the way. We make 3 holes and all that. Camera will be there. And actually, automatically, that will be stitched inside only.
Technology based.
Technology based and all that.
Okay, so sir, was there any non-operational treatment possible before taking this call on your teacher?
see, in this particular case, it was not possible because the tear was massive. That is, if the tear was partial, I would have definitely treated with physiotherapy or platelet-rich plasma injection. But in his case, the tear was massive and it was involving 3 muscles. So I had no choice left except to offer him surgery. If I don't do surgery, the arthroscopic keyhole, what is a minimally invasive surgery, now, eventually in period of 3 to 6 months, I should have suggested him a shoulder replacement surgery, which was not necessary effort. So I explained my teacher, sir, this is the problem, this is how we have to go. And my teacher trusted me, and then I explained him how the treatment will be done and then how will be the recovery. And now everything is passed now, my teacher is absolutely good, so he is happy. That is what I need.
So how much time a surgery takes and how much time does it take to recover?
Normally for my arthroscopic rotator cuff repair, I take about 1.5 hours to maximum 2 hours if the tear is very massive. And for my teacher, we did it in 1.5 hours. As with any other surgery, there will be preparation time and surgical time and post-surgical time. During this time, the patient will be in the operation theatre. So 1 hour we need to give anesthesia, prepare mount or assembly, to prepare our table, everything. And after that 1.5 hours, and after that it will be 1 hour for them to come out of the surgery, come out of the anesthesia, and then they'll be in the recovery room, and then afterwards they'll be shifted to the ward.
Okay, and for how long they have to stay in the hospital? Like when do you discharge?
Just 1 day.
One
All
day?
my surgeries they'll take just 1 day. On the day of admission they'll do the surgery, next day they are going home.
Oh, that's really fantastic.
Yeah, that's the beauty of my keyhole surgery.
Right, so that people
It's
don't
a
have
bloodless surgery with very less pain, patient will be very comfortable, recovery is fast and assured. And only thing is they have to follow is my guidelines and advice to what not to do and what to do and do exercises.
Okay. So are you more of a person who gives a lot of medication or are you a person who treats them with a lot of physical activities? Like what suggestion do you give them?
I always treat my patient first, lifestyle correction, exercises, medications next. If none of them works or depending on that particular case, if that particular case demands surgery, like in my teacher, obviously I need to suggest a surgery only. I cannot hide that surgery is not advised. Because end of the day, it's the outcome what matters. If that outcome, that desired outcome will happen through surgery, let it be surgery. If that happens with physiotherapy or exercises or diet modification, yes, let it happen through that. It depends on the diagnosis what I get.
But after that, after the surgery, what suggestion do you give them so that they can recover fast and also for a lifetime, like so that they don't deal with the same problem?
Obviously exercises only, mainly exercises, and then it is not complicated matter at all. They just need to spend 15 minutes a day for their shoulder, if I am dealing with the shoulder, for the rest of their life. Their shoulder will be stronger than the non-operated shoulder.
Okay.
ಸರ್ ಇವಾಗ ನಾವು ನಿಮ್ಮ ರೈಟ್ ಶೋಲ್ಡರ್ನ ಆಪರೇಟ್ ಮಾಡಿದ್ವಲ್ಲ, ನಿಮ್ಮ ರೈಟ್ ಶೋಲ್ಡರ್ ರೊಟೇಟ್ ಕಫ್ ಟೇರ್ ಆಗಿತ್ತು. ನಾವು ಆಪರೇಟ್ ಮಾಡಿದ್ದು ಮೇನಲ್ಲಿ. ನಿಮ್ಗೆ ಎಷ್ಟು ದಿನದ ಮುಂಚೆ ಸರ್ ಇದು ತೊಂದರೆ ಶುರುವಾಗಿದ್ದು?
ಆಕ್ಚುಲಿ ಒಂದು 15 ಡೇಸ್ ಮೊದಲು ಶುರು ಆಯಿತು. 1 ವೀಕು ನಾನು ಇದು ಮಾಡಿದೆ. ಆಮೇಲೆ ನಿಮ್ಮ ಹತ್ರ ಬಂದದ್ದು ಗೊತ್ತಾಯಿತು. ಆಮೇಲೆ ಒಂದು 8 ಡೇಸ್ ಆದಮೇಲೆ ಆಪ್ರೇಷನ್ ಆದದ್ದು ಅಂತ ಕಾಣಿಸುತ್ತೆ.
ಓಕೆ ಸರ್. ಈಗ ಆಪರೇಷನ್ ಮುಂಚೆ ನಿಮಗೆ ಏನೇನು ಡಿಫಿಕಲ್ಟೀಸ್ ಇತ್ತು?
ಕೈ ಎತ್ತೋದಕ್ಕೆ ಆಗ್ತಾ ಇರಲಿಲ್ಲ. ಇಲ್ಲಿ ಶೋಲ್ಡರಲ್ಲಿ ಪೇನ್ ಇತ್ತು, ಇಲ್ಲಿ ಪೇನ್ ಇತ್ತು. ಐ ಕುಡ್ ಲೆಫ್ಟ್ ಪ್ರಾಪರ್ಲಿ ದಿ ರೈಟ್ ದಿಸ್ ಒನ್. ದಟ್ ವಾಸ್ ದಿ ಪ್ರಾಬ್ಲಮ್.
ಓಕೆ ಸರ್. ಈಗ ಅದೆಲ್ಲ ಪ್ರಾಬ್ಲಮ್ ಸಾಲ್ವ್ ಆಗಿದೆ?
ಪ್ರಾಬ್ಲಮ್ ಸಾಲ್ವ್ ಆಗಿದೆ. ಏನಿಲ್ಲ, ಐ ಕ್ಯಾನ್ ನಾರ್ಮಲ್ ಆಗಿ.
ಓಕೆ.
ಬಟ್ ಯು ಟೋಲ್ಡ್ ಮೀ ನಾಟ್ ಟು ಪುಟ್ ದಿ ಹ್ಯಾಂಡ್ ಲೈಕ್ ದಿಸ್. That one I never did it. Now recently I am doing it.
ಮಾಡಿ ಸರ್, ಕೈ ಎತ್ತಿ ನೋಡಿಸಿ ಆರಾಮ, ಕೈ ಮೇಲೆ ತನಕ ಹೋಗುತ್ತಲ್ಲ.
Super. I can do all the PT exercise. I never felt any pain
or discomfort.
Even after the operation, I never felt the pain at all. One day ಕೂಡ ಅದೇ ಅದೇನೋ ಕೊಡ್ತಾ ಇದ್ರೆ ನೀವು ಟಿಪ್ಸು ಇದ್ದಾಗ ಅಷ್ಟೇ. ಮನೆಗೆ ಬಂದ್ಮೇಲೆ ಐ ಥಿಂಕ್
ನಾನು ನೋಡಿಲ್ಲ ನೀವು ಪೋಸ್ಟ್ ಆಫ್ ರಿಕವರಿ. ನಾನಿನ್ನ ತಡೆದಿರ್ತಾ ಇದ್ದೆ ನಿಮ್ಮ ಸರ್, ಅದು ಮಾಡಬೇಡಿ, ಅದೇ ಆಪರೇಷನ್ ಆಗಿರೋ ಕೈಯಲ್ಲಿ ಭಾಗ ತೆಗಿಯಕ್ಕೆ ಹೋಗ್ತಿದ್ರಿ. ಆಪರೇಷನ್ ಆಗಿರೋ ಮರ್ಸ್ಬಿಟ್ಟು ಒಂದ್ಸರಿ ಪೌಚು ಬರ್ಸ್ಬಿಟ್ಟು ಬಂದಿದ್ರಿ ನೀವು, ಅಲ್ಲ ಸರ್?
ಅದರಿಂದ ನಾರ್ಮಲ್ ಆಗಿದ್ದೀನಿ, ಇವಾಗ ನಾರ್ಮಲ್ ಆಗಿದ್ದೀನಿ.